Hi, so I wanted to make a little update video. As I have mentioned in some of my previous videos, I have had a gastric bypass surgery done in July of 2020. This is I am almost 4 months out of the surgery, and I just want to make a little video about some of the side effects that I have had from the surgery. Now, little disclaimer. These are the side effects that are relatively minor, and they tend to be very common, and it's something that I expected to happen. And my surgeon's team is aware of these side effects, and they're completely normal, and I've been told that eventually they will work themselves out. And apparently it is very normal to be having some of these issues around 4 months after the surgery. And I just want to share my experience. I have had 3 side effects that I'm aware of and that I've been tracking. One of them is hair loss. Second one is problem with my menstrual cycle, and third one is being fairly constipated most of the time. Now, let's start off with constipation. I think I've mentioned in one of my previous videos that I've been basically constipated on and off since basically the first day of the surgery, and some days it's okay, and sometimes I go a whole week without having a movement. And in those, when it is getting in that bad of a shape, I have been advised to take a laxative by my doctor, and so it is doctor approved. I'm only used it maybe once a week in past 4 months, and I've also noticed now that I'm able to increase my fiber intake, I am able to have better weeks, and by that I mean I'm usually less constipated and usually don't need laxatives as often, which is great. So it's something that can be easily fixed, and eventually usually works itself out. It's just my system trying to figure itself out. Now, second one is the hair loss. As you can see, my hairline probably looks pretty okay right now. Actually, right here, it probably looks pretty okay right now, but I personally have noticed some hair loss. I'm actually trying to track the hair loss by making different videos, and I'm contemplating eventually making one whole video about it if the hair loss does continue. Just in general, it is like, especially when I brush my hair, it's the clumps that come out have been getting bigger. Also, during showers when I wash my hair, a lot of times I have excessive shedding. And just in general, sometimes when I wake up in the morning, I see excessive shedding in my bed with my hair. Apparently that is very normal too, especially around 3 or 4 months mark after, especially gastric bypass. Basically, that comes from the body just not being able to absorb as many nutrients, and also just the body being in shock from losing some of this weight. What I am doing about this is that my multivitamin already has pretty high biotin content, which supposed to help with hair loss. Also, my protein intake is pretty high, and I recently introduced a collagen drink to my diet. The brand that I use is Vital Proteins, and it has basically about 20 grams of collagen in it, and it also has 18 grams of protein in it. So it's basically an unflavored powder that you mix with some water and just drink it. Supposedly the collagen is supposed to help with hair health in general. I'm still not 100% sure if it's working or not for me, and it's just waiting game for your body to get used to hair loss and things like that. As I said before, I am making a video about it. I am every few days or so I record how much I'm losing just to keep track of it, and I am planning on making a full-length video about it, just to see what happens with my hair loss. And third problem that I have had is my menstrual cycle being really messed up. As I have mentioned in one of my previous videos, I do have PCOS, which is polycystic ovarian syndrome, which already makes my just menstrual cycle abnormal to begin with, and very radical. So I was expected to have period issues after surgery anyways, because that's basically norm for me. However, I am on medications for my PCOS. I do take progesterone pills, which basically way it works, for me at least, I do first 10 days of the month with a 10 milligram progesterone pill, and usually 2 or 3 or 4 days later I will have a menstrual cycle, and that has been working relatively well for me for past about 2.5 years or so. However, because of the surgery, I actually had to skip a month from of the progesterone, just to make sure that during the surgery I would not have any blood clots, since progesterone sometimes can make some people be more likely to develop a blood clot. So my doctor did suggest for me to skip a month, and I did that. And after the surgery, I think it was about 60-day gap for my menstrual cycle, which is pretty abnormal for me at least. since for past 2.5 years or so, my gap between them in the menstrual cycle usually would be about 32 to 33 days. So 60 days was pretty big gap. Then after that, when I actually had a menstrual cycle, it was very, very heavy. Like, at least for me, it was abnormally heavy. I haven't had a heavy period like that since I was maybe 18 years old, and I'm 29 now, so about 11 years I haven't had a heavy period like that. And my menstrual cycle after that, again, it came in on time, but it lasted 15 days, which is really abnormal for me. I mean, it was a light one, but it also lasted 15 days. And usually my period lasts about 4 days, three and a half, 4 days. And now I'm running almost, I want to say another 50 or so days since my last menstrual cycle. So it is, very radical. I am actually planning on seeing my OBGYN soon. I am actually seeing him in a few days, so I should be able to figure out if I have to do anything about it. Usually, the menstrual issues are very common if you're losing significant weight. I have lost 50 pounds in 4 months, so that is very significant weight. So usually what happens is that the fat storages tend to hold on to a lot of estrogen, and since I'm burning a lot of fat, this estrogen tends to get released in the body and can cause menstrual issues. So it could be due to that. At least that's what my doctor from my surgeon's office thinks that might be happening. And supposedly after a few months, once the body gets used to the weight loss and significant weight loss happens, usually the menstrual cycle manages to go back to normal. So hopefully I'll be able to have a normal cycle again in a few months. I'm definitely keeping an eye on anything that might look weird or any side effects, but those three are the only side effects I've ever had. So I guess I'm kind of lucky because it's nothing too serious, and I am under a doctor's supervision, and everything I'm dealing with is normal after this kind of surgery, and it was expected to happen. But yeah, I mean, yes, the side effects might sound kind of hard to deal with, but it is kind of worth it because, like I said, I've lost 50 pounds in 4 months, and I was actually able to lose 30 pounds before surgery. So in total, I have lost 80 pounds, which is really great for me. I still have about 120 pounds to go, but at the rate that I am going, I think I'll be able to do this within the next year and a half or so. Anyway, thank you very much for watching, and please do subscribe and leave any questions you might have in the comment section, and I will try my best to keep you updated. Bye.